Welcome back to the Deep Dive, where we take those dense stacks of research, articles, and white papers, and, well, we try to extract the absolute essence of what you need to know.
And today's stack is a big one.
It really is. We are diving deep into the infrastructure of modern medicine, and we're focusing on this profound and often overlooked paradox. How do you effectively protect patient data? I mean, we're talking about some of the most sensitive, high-stakes information that exists,
Right.
while simultaneously leveraging that very same data aggressively to improve care and, save lives.
It is the ultimate tightrope walk for modern healthcare providers. It really is.
A tightrope walk, I like that.
The necessity of becoming data-driven, to deliver precision medicine, it conflicts directly with the critical need to secure that data against threats that are just getting more and more sophisticated.
So for too long, it feels like the governance needed to balance those two things has been seen as, what, an optional expense?
Exactly. A nice to have, not a must have.
Right. So our mission statement today is to move beyond seeing information governance, or IG, as just some compliance exercise you have to check off a list.
Yeah, it's so much more than that.
We are going to unpack the necessary steps and, I think more importantly, the hard dollar justifications you need to establish a formal, enterprise-wide IG program in healthcare.
And this isn't just about plugging security holes.
No, it's about making the essential business case for better patient outcomes and, frankly, for organizational survival.
And if you need a seismic indicator of just how urgent this is, just consider this initial shock factor. Healthcare is. It's uniquely vulnerable.
How so?
It is the most targeted industry globally for data breaches, period.
The most targeted.
But beyond that, a landmark 2017 Panon Institute study confirmed that when a breach does happen in a healthcare setting, the cost of that breach is routinely twice as high as the cost in any other sector.
Wait, say that again? Twice as high.
Twice as high.
That statistic alone should be a mandatory line item in every single hospital budget presentation. I mean, why? Why is this sector so disproportionately expensive when it comes to failure?
Well, the vulnerability, it really stems from two main factors. First, the incredible long-term value of the data itself, which I'm sure we'll get into.
Yeah.
And second, the cost is inflated because when patient systems are compromised, the operational downtime it's just catastrophic.
It's not like a retail store going down.
Not at all. A retail breach, you lose transactions. A hospital breach, you halt procedures, you delay critical care, and you trigger these mandated notification responses and massive regulatory fines that just don't apply to other industries in the same way.
Okay, so over the next 30 minutes or so, we're going to look at the core business drivers that really compel this kind of investment. We'll define the crucial role of the executive sponsor who has to champion this sweeping change.
Absolutely key.
And we'll detail the concrete, measurable metrics, everything from reduced clinical errors all the way to lower legal e-discovery costs that define a successful IG investment. We're moving from this sort of abstract necessity to the quantifiable ROI.
Let's do it.
Okay, let's unpack this. In the current economic climate, no major enterprise program, and especially one that touches every single department from billing to the operating room,
Right.
is going to get greenlit without producing measurable, sustainable returns that justify, a significant investment of staff, time, and tech.
Of course not.
So this is where information governance moves from some aspirational goal to a pure financial imperative.
Precisely. The core task of whoever is championing IG in an organization is to make sure the business case starts with hard dollar savings.
It has to.
It's just not enough to promise that things will be safer or better organized. The language of the business case has to convert those qualitative improvements.
Like patient satisfaction.
Exactly, like patient satisfaction or better data quality into quantifiable financial gains. Things like increased population health metrics or lower litigation exposure.
And the challenge here, I think, is isolating those savings. I mean, how do you measure the cost of something that didn't happen, like a breach that you managed to avoid?
That's a great challenge to raise, and it's a common one. You don't measure the savings from an avoided breach by, sheer luck. We use established actuarial risk models.
Okay, so it's a known science.
It is. When an organization implements formal, verifiable governance, things like mandatory data mapping and standardized security training for everyone,
Mm,
insurers see a dramatically reduced risk profile. It's that simple. And that translates immediately into lower cyber insurance premiums.
which is a hard, tangible cost reduction.
Absolutely. If the program costs, say, $500,000, but it lowers your annual premium by $100,000 and it prevents one potential $5 million fine, the ROI is mathematically proven right there.
Okay, so let's try to synthesize these measurable benefits. We looked at the research, and it seems like there are 4 primary categories where IG provides a really concrete payback, financially and operationally.
That's right. The first one, as we just discussed, is information risk reduction.
Okay.
This is that measurable saving you get from lowering those cyber insurance premiums and, of course, avoiding the catastrophic costs that come with major incidents.
So that's fines, notification costs, the downtime.
All of it, the multi-million-dollar costs of just getting your operations back online.
Okay, so moving beyond just pure risk avoidance,
Yeah.
what's the second area? The one that's, you could say, the most mission-critical one.
That would be clinical safety and outcome improvement. This is the highest value benefit.
And how do you measure that?
We measure this through a reduction in medical mistakes and a demonstrable improvement in clinical outcomes, like, say, reduced mortality rates for specific conditions. If an IG program costs money but it saves lives, that investment is defensible regardless of market conditions.
Right, that transcends the balance sheet.
It has to.
And then we get into the realm of compliance and litigation.
It's number 3, legal and compliance defensibility. IG actively and measurably reduces the organization's legal exposure.
How?
By managing data properly from the moment it's created to the moment it's disposed of, organizations lower litigation costs, especially in e-discovery, and they prevent those really debilitating compliance penalties from regulators.
Like the OCR for HEPI violations?
Or international bodies for GDPR breaches, yeah.
Okay. And finally, there's a category that I think often gets overlooked when we're chasing these big fines, but it adds up significantly across an entire workforce.
You're talking about knowledge worker productivity.
Exactly.
And it is absolutely crucial. When IG ensures data is accurate and, importantly, easily searchable, your knowledge workers, your physicians, nurses, administrators, they are instantly more productive.
They're not wasting time hunting for things.
Yeah, exactly. They spend less time searching for the right file or trying to cross-reference conflicting patient records. This directly translates into efficiency gains that allow staff to handle more patients, boost billable hours, and just make faster, better-informed decisions.
This all really relies on a truly enterprise-wide approach. We noted that the executive sponsor is crucial. Why is that role so important? I mean, why can't the CIO who manages the data systems or the compliance officer who handles IPAY, why can't they just run the IG program?
Because IG is, by its very definition, enterprise-wide. It cannot be siloed.
It's not just an IT problem or a legal problem.
Not at all. It spans clinical practice, IT infrastructure, legal retention policies, administrative policy, everything. If the CIO runs it, the clinical staff might just see it as another IT burden.
Here comes IT with another rule.
Right. And if legal runs it, staff might see it as just more compliance overhead. The executive sponsor, they have to have the seniority, often at the C-suite level.
Like a chief operating officer?
Or a chief medical officer, someone with clout to allocate resources across those silos and mandate compliance across the entire organization.
So they are the ultimate champions. They have to develop, own, and then actively defend the business case, translating what seems like a technical necessity into mission-critical action.
That's it, exactly. They are the ones who connect the dots between the technical governance policies, like standardized metadata, for instance, and the human outcome.
The better patient outcome.
Better population health indicators and mortality reduction. Without that executive ownership, the program will inevitably stall the second it hits the inevitable departmental resistance.
So if we synthesize all these drivers, the macro-level goal of governance is really multifaceted. It's enhancing patient outcomes, right up to and including mortality reduction.
Yes.
And it's preventing those critical leaks of EPHI and EPII, avoiding the massive financial and reputational fines.
And tying it all together is the lowering of operational costs. By implementing defensible data management, knowing exactly what data you have, where it is, and why you're keeping it, you just spend less money.
Less money storing junk data.
Less money storing obsolete data, and exponentially less money searching for that data, securing it, and dealing with it when a legal matter comes up.
Here's where it gets really interesting, I think, because we move past the balance sheet and into the ultimate human benefit.
Mm-hmm.
The ultimate non-negotiable objective of IG in healthcare isn't just about minimizing risk, it's about saving lives and improving clinical outcomes.
It is.
And this reframes the entire discussion, right? It moves IG out of the realm of a pure IT cost center and squarely into clinical necessity.
That is the pivotal realization that drives the investment. When leadership finally recognizes that a failure in data governance is a direct threat to patient safety, the resources suddenly become available.
So it's not governance for its own sake.
It's governance as a life support system.
So how does data governance, which sounds inherently technical, metadata, retention schedules, how does that directly impact the patient who's actually receiving care?
Well, it boils down to data quality. Data governance ensures that the massive amounts of data being generated every single minute from lab results, imaging scans, physician's notes, billing records is clean, accurate, and consistent.
And that reliability is essential.
It's everything. Think about running longitudinal studies or using sophisticated predictive analytics. If the underlying clinical data is fragmented or inaccurate or inconsistent across different systems,
Your results are garbage.
the insights you get are, at best, useless. At worst, they are dangerously misleading, and they can lead directly to medical error.
And we have to address the grim reality here. The data shows that medical errors are tragically the third leading cause of death in the United States.
It's a staggering human cost.
It is a profound crisis.
And IG programs are a direct intervention against that crisis. They strengthen data accuracy and accountability by creating processes like data lineage.
Which is what
It's basically tracking data from its source all the way to its use and ensuring golden records, which means there is one unified, accurate patient identity across all your disparate systems.
So no more conflicting information.
Right. If a system is in place to verify every piece of patient history, every medication, every lab result, the likelihood of a systemic medical error like prescribing a drug the patient is allergic to because that allergy was logged in some incompatible system, that likelihood decreases significantly.
I think the biggest challenge for listeners is grasping that this isn't just about preventing bad things from happening. It's about enabling great things.
Yes.
Tell us again about the sophisticated use of data analytics you mentioned.
High-quality, governed data is the fuel for advanced analytics and AI. The example of Boston Children's Hospital's Health Map platform is just exceptional.
Right.
The system doesn't just wait for internal reports. It uses AI to detect disease outbreaks by synthesizing insights from billions of global data points, social media trends, news reports, local health data, and more.
So it's like a global intelligence engine for public health.
Exactly. But it can only function if the data it's collecting is governed. Imagine if every source used different terminology for the same symptom, or if the timestamps were unreliable.
It would be chaos.
The real-time governance that IG provides ensures that this massive, complex, multi-source data lake is reliable and standardized. This proactive, real-time control demonstrates a direct, tangible, life-saving function, improving outbreak control, allowing hospitals to proactively allocate resources, and ultimately safeguarding community health.
So this moves us into the quantifiable realm. If you are presenting an IG business case that's centered on clinical excellence, what are the hard metrics you need to prove success?
The metrics have to be tied explicitly to population health outcomes and clinical performance. That makes it clear that IG is an operational asset.
So, for example,
The program should commit to a hard timeline, launch a new medical error detection system, build on these new, clean, governed data feeds within 6 months.
okay, so that's the mechanism. What are the results you'd measure?
The results are measurable safety improvements. The IG program should aim to reduce verifiable medical mistakes by a targeted percentage, let's say 10% in 2 years.
That's a direct, measurable impact on patient safety and the organization's liability.
Absolutely. Similarly, they should target lower mortality rates for specific high-risk conditions by, say, 5% in 3 years, and be able to correlate those gains with the implementation of cleaner, data-driven treatment pathways.
These targets are powerful because they link that technical investment directly to the core mission.
And you can broaden the metrics to capture the softer but still financially critical aspects of care. For example, aiming to raise patient satisfaction scores by 20% within 2 years.
That matters because
Satisfied patients are often the ones who received care that was timely and accurate, which is the result of streamlined, data-efficient internal processes. And loyalty reduces churn, which protects your long-term revenue base.
we established that healthcare is the most targeted and costly industry for breaches. Now, let's explore in detail why. Why is the data itself such a high-value target? What makes cybercriminals so relentlessly focused on breaching these systems?
Because healthcare data, or EPHI, Electronic Protected Health Information, it's just fundamentally different from other data sets.
How so?
It is the most comprehensive data set available on any individual. It contains information that is not only personally identifiable, but is longitudinal. It's their whole life.
So you've got social security numbers, insurance details.
Family medical histories, biometrics, diagnoses, financial information, a credit card number that expires in a few years. EPHI is valuable for identity theft and sophisticated fraud for decades.
And that high value leads to more sophisticated multi-use fraud. The source material noted this really alarming exploitation risk where stolen credentials can be used to fraudulently obtain medical procedures.
And this is so much more than just financial fraud. This is a severe patient safety crisis.
Right.
If a criminal uses your identity to receive medical treatment, those records are now merged with yours. Should you later require legitimate care, the treating physician might pull up a corrupted record with incorrect blood types, inaccurate medication lists, or false histories.
Leading directly to misdiagnosis.
Or incorrect, potentially lethal treatment. The IG failure has immediate clinical consequences for the victim.
And this leads us directly to the trust crisis. Information security isn't just an IT problem, it's a core business problem, and it's absolutely vital for maintaining public confidence. If that trust is lost, patients walk away.
They do, and the statistic is chilling. Over 2/3 of patients surveyed said they would leave a provider that suffered a major high-profile ransomware breach.
2/3.
It demonstrates that a security failure isn't merely a fine you pay to the regulator. It's an existential threat to the organization's patient base and its revenue stream. You cannot absorb a 2/3 loss of your customer base and remain viable.
Let's give the listeners some concrete examples that illustrate the scale and variety of these threats. Because the problem isn't just one type of hacker, is it?
That's right. We see failures across the board. Take the example of Mid-Michigan Physicians. They were hit with a $475,000 HIPAA-OPA fine. And significantly, this fine wasn't just for the breach itself, but for delayed breach reporting. So your IG procedures have to mandate timely, defensible reporting protocols.
And often, the threat is internal. I remember the case of Bupa Insurance. 100,000 records stolen. That was an employee.
Right, which underlines the critical need for strong internal governance, access controls, and behavioral training.
And then there's just operational failure.
Another huge vector, Washington State University lost 1 million records through a simple physical event, a stolen hard drive.
A stolen hard drive.
It shows the failure point can be low tech, but the exposure remains immense. And then you have the massive exposure at Molina Healthcare, where 4.8 million accounts were exposed because of a portal flaw. That shows that application security, a key component of IG, is paramount.
So the IG program has to address physical security, insider threats, and application vulnerabilities all at the same time.
Simultaneously.
Let's focus on the modern scourge of ransomware. We know that since 2016, the Office for Civil Rights, the OCR, they classified ransomware as a mandatory high-pay breach demanding formal notification. This increased pressure puts providers in an impossible dilemma when they're locked out of their own systems.
And this is where we see the stark, quantifiable difference between proactive governance and reactive crisis management. We have two chilling case studies that really define the scale of this investment failure.
Okay.
First, look at Erie County Medical Center. They took the principled stand. They refused to pay a relatively modest $30,000 ransom.
Okay, they did the right thing.
But this decision led to catastrophic, protracted operational downtime. The recovery efforts cost them approximately $10 million.
$10 million. Because they resisted a $30,000 payment. That is an enormous financial penalty.
Now, contrast that with Hollywood Presbyterian. Faced with the same crisis, they chose pragmatism and paid a $17,000 ransom to restore access quickly.
A much smaller number.
While paying raises obvious ethical questions about funding criminal enterprises, the immediate financial impact was orders of magnitude smaller than Erie's. The $10 million in downtime suffered by Erie County would have financed a robust, enterprise-wide IG program for years, ensuring they never had to make that choice in the first place.
That comparison is it's the single most powerful justification for proactive IG investment I can imagine.
It really is.
This raises an important question, though. As hospitals become smarter and more connected, the threat expands beyond the server room. What specific risk is posed by connected medical devices, the so-called Internet of Medical Things?
This is the critical existential threat that requires immediate governance intervention because it links technical vulnerability directly to an immediate fatality risk. On average, you've got 10 to 15 connected devices per hospital, bed infusion pumps, patient monitors, imaging equipment.
And these devices often run on, what, outdated software?
Outdated or insecure operating systems, yes. If they are hacked, the intruder doesn't just steal data, they can potentially alter care delivery.
You are describing potentially lethal physical harm engineered through a remote digital exploit.
Precisely. We saw a stark public alarm back in 2017 when the Department of Homeland Security issued a specific warning about Smith Medical infusion pump vulnerabilities.
I remember that.
If an attacker can remotely manipulate a drug dosage or disable a ventilator via an unpatched device that lacks strong governance controls, the consequences are instantaneous and catastrophic. IG has to extend its reach beyond the EHR system and encompass the full life cycle of every single connected medical device.
So to counter these pervasive and varied threats, from, a physical hard drive theft to sophisticated ransomware and medical device hijacking, what tangible cybersecurity metrics must an IG program commit to delivering to show that measurable ROI?
The goals have to be actionable, enterprise-wide, and time-bound. They have to move the needle on organizational resilience.
Give me some examples.
Okay. For instance, the IG program should commit to conducting organization-wide cyber hygiene training for all staff within 90 days, implementing ongoing awareness campaigns that use specific modern attack vectors like phishing simulations also within 90 days, and critically, performing breach simulations, running that $10 million Erie County scenario, and updating procedures based on what you learn, again, within 90 days.
And then tracking verifiable reductions in actual incidents.
Yes. The program has to set targets to cut lost or stolen devices, that's the WSU scenario, by 50% year over year. That is a tangible physical security goal. And of course, aim to reduce successful hacker intrusions by 25% year over year. These quantifiable security goals demonstrate that the IG investment is directly mitigating the threats that cost millions.
Right.
While security, the technological hardening of the infrastructure is paramount, it's really only the foundation.
What do you mean?
Security serves the goal of privacy. Privacy is the legal, ethical, and moral framework that dictates how data must be handled, used, and eventually disposed of.
And we noted that information governance is rooted deeply in the ethical history of medicine itself.
Absolutely. The IG program is really the modern mechanism for fulfilling that ancient commitment inherent in the Hippocratic Oath. I will respect the privacy of my patients.
So privacy isn't some modern invention.
Not at all. IG simply provides the structure and the tools necessary to maintain that ancient ethical mandate in a world that is just saturated with digital data.
Given the prevalence of insider threats and the complexity of modern attacks, what does effective privacy protection actually look like? It has to be more than just a simple annual training module that everyone clicks through.
It requires continuous, structured awareness and behavioral training. Staff have to be trained not just on the HIPAA rules, but on the practical implications of patients' data rights and confidentiality laws.
And the behavioral part.
The behavioral training has to cover the modern threats, recognizing sophisticated phishing and smishing attempts, managing ransomware indicators, and the safe, professional use of email, cloud services, and social media. One misplaced email or one social media post can trigger a massive compliance fine.
And the metrics for this training, I assume they need to be aggressive to match the threat.
Yes. Given the immediacy of the risk, the goal should probably be to train 50% of staff in 45 days or less, and then achieve 100% organizational coverage in 90 days or less.
That's fast.
And furthermore, a continuous communication plan must be launched within 90 days to reinforce that privacy knowledge, because a single annual training session is just not sufficient to counter threats that are constantly evolving.
Okay, let's shift now from risk avoidance to pure operational efficiency. The concept of legally defensible deletion seems counterintuitive for an industry that's obsessed with keeping records. How does getting rid of data actually save an organization money and reduce risk?
This is the massive efficiency lever in IG. We are fighting the ROT, problem redundant, outdated, and trivial information.
ROT, I like that.
Studies consistently show that ROT constitutes anywhere from 40 to 70% of all stored data within an organization.
40 to 70%.
It's dark data, data that has no current clinical value, no legal retention requirement, but which the organization is spending money to store, to secure, to back up, and potentially review in the event of litigation.
So for every dollar you spend on storage, 40 to 70 cents is just wasted on junk.
Essentially, yes. And it's not just the storage cost, is it?
What else?
No. Every single piece of ROT is a piece of risk. If you keep a record past its legal requirement, you increase the chance it will be breached, and you increase the cost of retrieving all your files during e-discovery. By implementing defensible deletion, a documented, standardized process for eliminating data once its retention period expires, you dramatically lower storage costs, reduce compliance burdens, and you shrink the attack surface.
So you get a smaller storage footprint, which makes data findability easier, and that improves worker efficiency.
Exactly.
What are the operational metrics for tackling that massive pile of unnecessary data?
The goals have to be aggressive and measurable against that baseline 40 to 70% figure. So the IG program should aim to cut ROT on shared drives from, say, 40% down to 20% in 1 year.
Okay.
And simultaneously, because less data needs to be backed up and stored, they should aim to lower the total storage footprint by 20% in just 6 months, generating immediate hard cost savings.
And the corresponding efficiency gain for the staff. How do you measure that?
That is measured in time saved. Wasted time searching for information accounts for a staggering 15 to 25% of the average knowledge worker's week.
A quarter of their week just looking for stuff.
By implementing clean governance, the goal is to reduce the time staff spend searching for information by 25% in 1 year. That is a direct payroll efficiency saving.
This reduction in ESI, or electronically stored information, that must have massive repercussions when a hospital actually gets sued. The legal costs for discovery are, I've heard, astronomical.
They are. When an organization is faced with a legal request for information, the sheer volume of ESI makes the process expensive and time-consuming. A comprehensive IG program ensures litigation readiness.
Because the data is already organized.
It's already organized, classified, tagged with retention requirements, and it's ROT-free. So the organization is ready for audits, litigation, and regulatory reviews instantly, rather than facing this mad scramble to try and classify millions of files under pressure.
Let's focus on the hard dollar win here, because the financial metric for e-discovery reduction is often the fastest ROI component, isn't it?
It is the most demonstrable cost offset. Attorneys often charge per gigabyte for document review during litigation. Documentation shows that a robust IG implementation can reduce those attorney review costs from a staggering $18,000 per gigabyte.
$18,000.
Down to $10,000 or less per gigabyte within 1 year.
So you're saving $8,000 per gigabyte? That's a massive saving.
It is, and it's achieved through efficiency and automation.
How does that reduction actually happen? What specific tools are being implemented?
The savings come from automating the early stages of review. We track the implementation of tools like predictive coding.
Predictive coding.
It's essentially using machine learning, or AI, to review and classify documents based on their relevance to a specific legal case. So instead of human attorneys spending thousands of hours reviewing every single email, the system quickly identifies and prioritizes the relevant, say, 5% of documents.
And that drastically reduces the total number of hours the expensive attorneys need to bill.
Exactly. So IG makes the data clean enough for these AI tools to work effectively, which in turn cuts the human labor cost dramatically.
So the legal metrics for the IG program must include implementing these predictive coding tools within, 6 months?
At least. And ensuring that ROT cleanup achieves that crucial sub 20% residual level within 1 year. These actions standardize the ESI, making the legal process faster, cheaper, and more defensible.
Often, organizational priorities don't shift because of some proactive, strategic decision backed by a beautiful ROI model. They shift because of a catastrophe. The source material refers to this phenomenon as the one big negative event.
Catastrophic incidents are the ultimate mandate for change. They shift corporate priorities overnight because the damage to reputation, financials, and trust is immediate and undeniable.
We saw this historically after events like 9/11 and Hurricane Katrina, forcing new operational paradigms.
And today, we see it with massive data breaches and catastrophic system failures, like that $10 million downtime at Erie County.
A single costly lawsuit, a major HEPA fine, or a high-profile breach compels leadership to invest in enterprise-wide reforms just to restore security and trust. It's a reactive way to fund IG, but sometimes only a crisis can overcome that organizational inertia.
And while it might be reactive, the resulting investment still has to be sustained by a credible ROI model long term.
Right.
This model requires clear pre- and post-implementation cost baselines. If you can't accurately define your current e-discovery spend or your current storage cost, you can't prove the savings that the IG program delivers later. Metrics are essential for continuity.
Osterman research provided some clear insight into the top business drivers that actually get these IG programs off the ground. What were the top 3 that organizations prioritize?
The research highlighted 3 clear imperatives. Number 1, and logically so, is risk avoidance, the desire to avoid the massive fines, litigation, and breach costs we've been talking about. Number 2 is regulatory compliance mitigation, reducing exposure to governmental bodies like the OCR, which carries significant legal penalties. And number 3, which connects directly to the efficiency side, is employee productivity improvement.
Let's break down how IG translates into financial terms one last time, synthesizing those hard and soft cost components for everyone.
We can itemize these savings pretty clearly. For hard cost savings, IG provides better, standardized ESI organization, which reduces the time spent on litigation collection. Removing all those unnecessary files drastically lowers document review hours. And the defensible deletion we spent time on creates massive storage savings in hardware, energy consumption, cloud service fees, and the staffing required to manage that reduced storage footprint.
And then there are the soft cost offsets, which might be less obvious, but they represent true revenue gains.
These are the intangible benefits that provide financial payback. Revenue gains are realized because staff time, once it's freed from dealing with data chaos, can be dedicated to boosting billing or collections or service innovation. And risk reduction minimizes exposure to litigation and regulatory violations, saving millions in potential penalties.
And finally, let's emphasize the productivity gains one last time, because they affect the average employee every single day.
Productivity gains are perhaps the most pervasive financial benefit of all. IG minimizes wasted search time. If you consider that wasted time searching for information accounts for 15 to 25% of the average work week,
A huge number.
cutting that inefficiency by a quarter across thousands of employees represents substantial payroll savings and ensures staff are making higher quality data-driven decisions much faster.
So what does this all mean for you? Let's summarize the 3 core takeaways from this deep dive into making the business case for healthcare information governance.
First, I think you have to remember the fundamental vulnerability.
Yeah.
Healthcare data remains the richest and most costly target for cyber attacks.
Because of its long-term value.
Right, leading to costs that are twice as high as any other sector. The stakes are truly existential for any institution that fails to govern its data.
Second, the business case for IG has to be robust and really dual-pronged. It's built on measurable financial returns, chiefly from lowering storage costs through defensible deletion and dramatically reducing legal e-discovery costs.
By implementing tools like predictive coding.
Right, combined with the intangible but critical benefits of trust and safety, which directly influence patient retention and clinical outcomes.
And third, the entire justification hinges on realizing that IG is a clinical investment, not an administrative overhead. The focus has to remain anchored to the core mission:
Patient outcome improvement.
privacy protection and risk mitigation. Those are what ultimately justify the massive resources required. A robust IG program, it's non-optional. It is a resilient infrastructure required to survive the modern threat landscape.
A robust IG program reinforces organizational resilience and, as we saw with that extreme financial contrast, the $10 million downtime cost versus the $17,000 ransom payment, the cost of failure far, far outweighs the cost of prevention. The proactive investment is just the sound financial choice.
It is the only way forward.
We spent a lot of time noting that defensible deletion is key to lowering costs and risk. You have to eliminate that 40 to 70% ROT. So here is a provocative thought for you to mull over in your own exploration. Considering that the Hippocratic Oath demands respect for patient privacy, does ethical data disposal mean that data must be deleted once its legal or clinical necessity expires, regardless of whether it's expensive to keep? Is deletion an ethical and professional mandate, not just a financial and operational one?
A question of duty that really defines modern governance.
We'll catch you next time for the next deep dive.